Hi, my name is Chris. Thank you for tuning in again. This next paper is another OB landmark, and this is actually the ALPS trial. It stands for the Antenatal Betamethasone for Women at Risk of Late Preterm Delivery. This is a multi-centered randomized trial that was out in 2016, published in NEJM. What this paper was looking at, though, was patients, singleton pregnancy, between the ages of 34 and 35 and 5, and determined if steroid administration improved fetal outcome. The study worked by bringing in a group of patients and determining if they were high risk of delivery in the late preterm period. So if they had preterm labor with a 3 centimeter dilated cervix or 75% effacement, or they prommed, or if the doctor had just some general suspicion that they were going to deliver soon, then they were included in the trial. But if they thought they were going to deliver too soon, like in the next 12 hours, or if they had choreo or 8 centimeter dilated cervix, or they were having more than 6 contractions an hour, or if the baby's heart rate tracing wasn't looking too hot, then they weren't allowed in the study. So it was like a population that was going to deliver soon, like in the 7 days, but not immediately, so they wouldn't be able to achieve completion of the steroid course. So the study's design was a one-to-one, a simple earn method approach for randomization. So you have your betamethasone and you have your placebo arm. And the way it was administered and the way we do it right now is 12 milligrams IM Q24 hour for 2 dose. So you got the betamethasone and placebo, and it was randomization, and it was also blinded. So the providers didn't know what type of medication they were giving. And they were followed throughout. And it's important to note that in the study that ideally, you're supposed to get 2 doses to complete the course for steroids, but only 60% was achieved in the betamethasone arm and 58% was achieved in the placebo arm, and majority of reason for this was ended up being delivery by the patient. So even though they didn't think they were going to deliver in 12 hours, they still ended up delivering like within the next 24, and couldn't complete the further second course of their arm. And what the people in the study were looking at to determine whether the steroids were beneficial, their primary outcome was a neonatal composite of treatment in the first 72 hours. This was CPAP, high flow nasal cannula, supplemental oxygen, extracorporeal membrane oxygen, or neonatal death within 72 hours of delivery. So if you look at table 2, this is the neonatal respiratory outcomes, and we'll go why it's respiratory only. You can see that CPAP for sure, 0.01 p-value. Need for resuscitation significantly decreased in betamethasone population. TTTN, same. Bronchopulmonary dysplasia, same. Surfactant use decreased in betamethasone also. And then also this composite overall. So all of those things from a respiratory perspective were actually decreased. Like they were better in the patients that were receiving betamethasone. So overall what that means is there was a 20% reduction in respiratory suboptimal respiratory outcomes if you gave betamethasone. And the flip coin of that, and the paper notes this, is that there was a 60% increase in patients who got betamethasone that they would also have neonatal hypoglycemia. But they eloquently explain that this is a self-limiting process, and even babies that had that diagnosis were still discharged 2 days earlier than their other counterparts. And looking at it as well, they didn't look at blood sugars as well because this paper wasn't looking at the glycolytic effect or glucose effects of betamethasone. But that obviously is a possibility for research in the future. And lastly, it's important to point out that there were no differences in certain aspects. So from a neonatal perspective, the non-differences was there was no difference in neck, no difference in sepsis, no difference in IVH, hyperbilirubinemia, but there was a decrease in the duration of stay within the NICU. From the maternal aspect, there was no difference in choreo, there was no difference in C-sections, and there was no difference in endometritis. The last thing I want to touch on for the paper is just briefly the mechanism of action of glucocorticoids in reference to fetal lung maturity. So when receiving betamethasone, its effects actually accelerate the thinning of the double capillary membrane that's used for gas exchange. It also speeds up the maturation of type 2 pneumocytes, which usually are present around 24 to 34 weeks. And finally, betamethasone is shown to actually increase surfactant production, which is a molecule that's used to embed into the water membrane and decrease surface tension, allow for easier capability to expand lungs. So that's the reason why betamethasone is effective, and that's why they were looking at the respiratory effects. I hope this review is helpful, and see you at the next one.